The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, over the course of the last 5 years, long-term care patients have occupied 718,230 hospital bed days in our health care system. Here is another fact. The cost of those bed days to the province over that period has been more than $933 million. Mr. Speaker, how can the Premier justify not opening a single nursing home bed in this budget when his failure to invest in long-term care has cost our province over this period just short of $1 billion?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to remind the honourable member when we came into government following his party being in power, Mr. Speaker, we reduced the long-term care wait list by over 50%, providing more options to Nova Scotia families. We've heard very clear from seniors, Mr. Speaker, people in this province who want to be at home, being cared for by their loved one as long as they absolutely can. It's why we continue to invest, Mr. Speaker, in the Caregiver Allowance Program, which is working with families, home care, which has been a substantial increase in every one of our governments. But again, I want to go back to the numbers that the honourable member is using. He's not accurate. Not all of those people, Mr. Speaker, are waiting for long-term care. Some of those people are in palliative care, Mr. Speaker. There were a number of reasons why they were there. They were trying to transition to home. We needed to put in place supports for them to be able to transition to home. These are important factors that he's leaving out when he takes the numbers and cherry picks to make his argument. The fact of the matter is we continue to reduce the number of people waiting on long-term care lists, and we'll continue to look at the alternative. And if the requirement for more beds, Mr. Speaker, it will become part of our capital plan.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, what the Premier has said about inaccuracy and cherry-picking numbers is not the case. These are not my numbers. They are not the NDP's numbers. They are the numbers of the Canadian Institute for Health Information. Mr. Speaker, if every person waiting in a hospital bed for a nursing home placement over the last 5 years in Nova Scotia had gone directly to a long-term care facility, the province would have saved $750 million. Mr. Speaker, when the Premier took office 5 years ago, he inherited a plan to open over 300 new nursing home beds. This would have taken all kinds of pressure off our health care system. It would have saved us millions. Can the Premier explain why it is that he did not act on this plan to open new nursing home beds, which was sitting on his desk when he came to office?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question, Mr. Speaker. One of the challenges, Mr. Speaker, when we came into government, we had a $500 million hole, Mr. Speaker, that we had to deal with because the honourable member and his party wouldn't represent all Nova Scotians when it came to the bargaining table. He gave a 7.5% raise across the public sector, which is $700 million cost of delivering services into the people of this province, Mr. Speaker. The fact of the matter is, Mr. Speaker, every credit agency, when they saw that government continue to look at this province in a negative way, private sector people were leaving, population was going down, young people were looking for hope elsewhere. The reality is, Mr. Speaker, you need to strike a balance. You need to ensure that we provide opportunity for young people to grow the economy, to provide governments with more money to be able to invest in the very things that he's talking about. But he should listen to actual Nova Scotians who say, I would like to be home as long as humanly possible in my home. It's why we invested in home care, Mr. Speaker. It's why he should listen to families who say, when I care for a loved one, I should be treated appropriately. That's why we've expanded the caregiver's allowance. This is striking the right balance to ensure that we can live within our fiscal means.
The Honourable Member. Honourable Leader of the New Democratic Party.
Mr. Speaker, the Premier has demonstrated how fond he is of attempting to control a conversation, but there is something that the Premier nor this government can control, and that is the fact that none of us is going to get any younger. Mr. Speaker, people in Nova Scotia are going to need nursing homes, whether the government likes that or not. So I want to ask the Premier, Mr. Speaker, why can't he see that by not opening a single new nursing home bed in our province, all he's doing is putting off and deferring inevitable necessary spending and putting us in a place where we're going to have to make massive expenditures down the road?
The Honourable Premier.
Mr. Speaker, he's going back in a time, Mr. Speaker, when the Democratic Party were governing this province. No one is ignoring the issues facing this province today, Mr. Speaker. This government has responded to the needs across this province. I want to remind the honourable member, in every budget, we've invested in home care. More Nova Scotians tell us they want to stay home as long as possible. We've heard from families who said to us, we want to care for our loved ones. We've invested, Mr. Speaker. If I had followed the recipe that the Democratic Party had left on the Premier's desk, this province would be in a hole, Mr. Speaker, unrecoverable. Our children will be looking for hope somewhere else. The reality of it is not only are our children seeing a future here, the young people from around the world are seeing a future here. At the same time, Mr. Speaker, we're striking the right balance of providing care to those individuals, providing quality education to our citizens, ensuring vulnerable Nova Scotians get looked after, and by the way, creating an economy that the rest of Canada is.